everyone.
Hey, everybody, we're live.
Thanks for joining me for today's LinkedIn Live. We have one of our great friends and amazing medical marketer out there, is what we say, because he does such a good job. But he's actually, tell him a little bit about yourself, Richard, from AIB. And I know a lot of you out there have seen a lot of our posts about AIB and our partnership, and definitely I've seen Richard's post about the amazing things they're doing and the ground they're breaking when it comes to audiology. So tell them a little bit more about the AIB experience and who you are.
Thank you, Kelly. Kelly and Justin, thank you both for inviting me to be a part of the podcast.
Yeah, we're
and
so glad
thank
to
you
have
for
you
the
on.
great work that you've done in our work together, marketing not just for AIB, but for our 86 ENT, audiology, and neurology practices around the country who are AIB Centers of Specialty Care licensees. Well, let me just give you a little bit about my background. I'm a PhD, poor honest doctor, not an MD, not a money doctor. My PhD is from The Ohio State in neuropsychology, neurophysiology. I was originally part of my training was at Wright-Patterson Air Force Base and with the Air Force and NASA as it related to returning astronauts and mission specialists coming back from the early space shuttles in the late 70s and early 80s, coming back with dizziness, vertigo, imbalance, and what we had to do to get these otherwise outstanding physical specimens back in shape, because as you know, the Air Force and NASA didn't have an unlimited supply of astronauts and mission specialists. So much of what is done in today's modern theories of what is called vestibular rehabilitation, neurodiagnostics, did not come out of actually civilian medicine and civilian rehabilitation, but as a direct result of space travel. So those of you who always wanted to know where your money went, spending money on going to the moon and the International Space Station, well, guess what? We now are using it to keep your grandma from falling and breaking a hip.
That's pretty
So
crazy.
your money was well spent.
That is fantastic. Wow.
The AIB is 30 years old. I started this when I was in third grade. Just kidding. This is our 30th anniversary.
Wow, that's
We
amazing.
are the largest dizziness and vertigo practice in the United States. Just here in the Tampa Bay area, we evaluate and treat about 800 patients a month. That's quite a bit.
Yeah.
We specialize both in neurodiagnostics, so we work almost exclusively from physician referral. So about 99% of our patients are coming from primary care, internal medicine, pediatricians, gerontologists, ENTs, endocrinologists. So basically, it's what we call a birth to earth practice. We see kids as young as 2 and 3 months of age. We do all the work for All Children's Johns Hopkins Pediatric Hospital, one of the great pediatric facilities in the country, all the way to people. I think our oldest patient was 107. Wow. And after seeing us, she is now on the International Space Station. So she's doing great. Just kidding. So we have a very, very wide-based practice. We have a large facility. We have several offices. We operate inside multi-specialty clinics, hospitals, and here in the Tampa Bay area, we have a staff of about 30. Now, nationwide, we have approximately 86 centers of specialty care.
Wow.
These are small practices, large practices, hospital systems, health systems, mostly audiology, ear, nose, and throat, also the big word otolaryngology, and neurology. These are the three silos that we operate in. This is through licensing agreements or what we call our platinum partnerships, where it is a partnership where AIB puts in the equipment, staffs, and basically manages all aspect of the operation for the physician group or health system. In addition to that, we have a very, very active education program. We are the largest educators worldwide of physical therapists, occupational therapists, athletic trainers in vestibular rehabilitation and concussion. We've trained over 13,000 over the last 30 years. Right now, we have 4,000 active AIB certified therapists virtually in every state in the union. We conduct most of this education online in a hybrid format, but we also conduct hands-on competency sessions in 12 US cities. In fact, as we speak, one of our teams is en route to Cincinnati, where they'll be doing a one-day competency training for 70 therapists in Covington, Kentucky, on the other side of the river from Cincinnati. In addition to that, we are a leading researcher in the area of pediatric and adult balance disorders and treatments. We have over 50 publications in scientific journals and 10 medical textbook chapters. All of this, by the way, you can access through dizzy.com. We believe in open access, so you can have free open access to dozens of textbook chapters, research articles, and the Dr. Gans blog, which are video case studies. So that's what we do in our spare time.
And that's amazing. And there's so much to unpack there, which is really kind of what our topic is today. And you've hit on several of those. I mean, you've been around for over 30 years. With everything that you've got going on, you really have become the gold standard. And kind of the topic title of today is doing just that, how to become a leader in your niche. Or I think even before we came on the broadcast, you said a category killer is how you describe it to a lot of people. And that's kind of right up Kelly and I's alley in terms of the marketing side. So I'd love to talk to, because back in the day, you were a practice owner, you didn't have all of this going on. So it's been a 30-year journey. So how, kind of taking a step back, how did you go from being a practice owner and serving patients to everything that you just described and becoming a category killer and starting to think a whole lot bigger?
Well, I've never had a business course. But as John Maxwell says, the only difference between you today and you 5 years from now is the people you meet and the books you read. I'm a huge believer in that. Read, read, read. Michael Gerber, Rich Dad, Poor Dad,
Yep.
Sharon Lechter, Jim Collins, right? Marcus Lemonis.
Mm-hmm.
You have access to some of the greatest and most successful minds in business. And then look for people that have been successful, right? And stay away from the naysayers. Oh, you can't do that. It's a belief lit.
Yeah,
right? Just
sure.
as Henry Ford said, whether you believe you can or you believe you can't, you're going to be right.
Yeah.
So your
Very true.
attitude sets your altitude, right?
And to that, like a lot of physicians don't have backgrounds in business, but to your point, you can become a very savvy business owner like you by diving in and learning from people around you.
It's so digestible, right? For example, Kawasaki and Lechter's classic Rich Dad, Poor Dad, right? And moving through, right, from being a doer to a manager to, right,
Mhm.
until you become an owner. So I'm an entrepreneur. I'm a serial entrepreneur. This is the second multi-million-dollar health business that I've developed in 40 years. My first business was family hearing centers. We were the largest private practice in audiology in the United States. From 1983 to 1989, we had 13 clinics from West Palm Beach to the Upper Keys. We sold that to a public company in 1989. I stayed with them as 2 years, learned about Wall Street, learned about what investors are interested in. It was a great education. And then I decided to go out in 92. I had a restrictive covenant. I couldn't stay in that same market. So I crossed the coast of Florida and we opened this practice in 92. I had the great fortune of having an amazing mentor, a fellow by the name of Brandon Dawson. Brandon was the founder of Audigy. I was one of the founding members, and he started that business from scratch in about 04, 05, and it was sold in 2015, 2016 for $150 million.
Wow.
So I've had my education is through having amazing mentors, reading. We had direct exposure, and sit in an audience and listen to Marcus Lemonis and Michael Gerber, John Maxwell. And if you don't learn leadership and competency and how to scale your business, then you're probably an eggplant.
It's true. I mean, it's a process. And when it comes to being successful, whether you're a practitioner or a business owner, processes can save your business, right? So save your medical practice. And that's a lot of what you guys have completely mastered in AIB for these providers out there. So when it comes to process, what is your process to scale?
Well, we've done a number of things. Number one, in working with our physicians, for example, I'm on a plane this month alone, thanks to Entropy Marketing, right? Thank you. You are amazing. And the team, your LinkedIn team, well, let me tell you, we are opening 4 massive practices this month.
That is amazing.
Sun City, Arizona, Walnut Creek, California, Norwalk, Connecticut, and just north of New Orleans in Mandeville. These are platinum.
All over.
We are placing in all of our equipment, our team, our staff, and that's all due to Entropy Marketing. That opened up the funnel for us to meet these physicians. Tuesday, I and my team, we're going to California. We've got 2 more prospects.
Yes.
One in Anaheim, California, big neurology group, and a big ENT group in Carlsbad, just north of San Diego. Thank you, Entropy, and your LinkedIn marketing. It works.
I really appreciate that. But I mean,
well, let me tell you what's even better. These are going to generate, each one of these will generate for AIB, bottom line, at least $10,000 to $12,000 a month. Bottom line.
That's amazing. That's an ROI right there.
That is what we want. That is
well, you did it. That was your program. We believed in you. So the scalability part of this is making sure you have, as you said, Kelly, the processes in place. So one of my other great gurus, who has long since passed, but is the grandpapa of all of the gurus, is Napoleon Hill. And Napoleon Hill said, action is the real measure of intelligence. So you can think about things, you can talk, I coulda, shoulda, woulda, and you never do it.
Right.
Don't be afraid to have a hiccup. You're going to hit bumps. Things are not always going to work out perfectly. You tweak them, you torque them. It's like 100%. Your grandmother's recipe for chicken soup, or your favorite bartender's perfect martini, or whatever it is, right? Don't be so concerned and obsessed that it's got to be perfect before I can even start.
Yes.
You've got to go there and then write it down.
Yes.
Write it down and make sure your team members, from the person who answers the phone to your physician liaison person to everybody, your appointment scheduler, right? Employees are not your best resource. That's not true. Good employees are your best resource. So we're a crew team.
Yes, I like that.
Everybody's oar has got to be in the water.
Yep.
And we better row in the correct direction. Right? So creating this, write it down. Let your staff know what the vision is. Let them know what their goals are. Incentivize people. What doesn't have to be money, could be with PTO time,
time off is a really big one too.
could be anything, right?
Working from home if they can. Yeah.
Absolutely. But it's not okay to have a subpar employee continue to be subpar. They're hurting your business and they're demoralizing your good employees.
Right.
So true.
If they are not coachable, they shouldn't be in that position, right? Because as far as we know, you never have another today. This is all I've got. When you get out of bed, this is today. Yeah. Today, what I do today can change my life forever and change the lives of other people. So as my mentor, Brandon Dawson, would say, you need to be cognizant and empathetic to the professional, personal, and financial goals of all of your staff. Because if you want them to have your back and you want them to work on your behalf, you better be working on their behalf.
For sure.
I think it was Richard Branson might have said, or he's Steve Jobs, one of the gurus, right? Basically said, take care of your employees. If you take care of your employees, the customer's not always right. Customer's not always right.
We know that.
But right. But you've got to have your employees back. And if you can't trust your employees to take good care of your customers, then you have the wrong person in the wrong job.
Mm-hmm. Very true. Yeah, I could not.
So scalability begins with your belief system. Mm-hmm. Write it down. Have your employees on board. Understand how they're going to execute, and have accountability. Again, you can think of it, we all walk around with a noose around our neck, but the end of that rope is on our own pocket. And how tight that noose gets is all us.
That's a good way to think about it.
It's up to us. So for all of you that are still joining in, I just wanted to say thank you so much. And we are definitely going to get to some of those questions. We have our guest today is Richard Gans. He is the leader of the AIB team. You can also find them at dizzy.com. And we're talking about his amazing journey in healthcare as an entrepreneur, but really the difference and impact that they are also making across the board when it comes to audiology and a lot of other factors in the healthcare space, from training to supporting to staffing to research. So I want you guys to really tune in. I know some of you have seen their post, and we did have a question. I think it came from Nicole for you. And it was, what are some of your, patient engagement tools that you guys use as a practice?
Well, there's a variety of things. Number one is education, education, education. Real estate, location, location, location. But we believe this. We know there's a couple of things. I'm going to answer your question, but you've asked a question of a PhD. You asked me what time it is. I'm going to tell you how to make a watch. Sorry. But it's important to understand. It's not just, well, I give them a brochure. So you manage what you measure. You manage what you measure. And in science, we say, if you didn't measure it, it didn't happen. Metrics, metrics, metrics. So let's talk about some of those things and how we get the metrics. But what I'm also going to suggest to you, look at our Google reviews and Facebook reviews. They will blow you away. You would not think that these people went to a medical office. You would think they went to a theme park because they sound like they just spent the day at Epcot.
Mm-hmm. Yeah.
Okay. Look at our Google reviews. Now, that starts the patient engagement.
For sure.
Because what do we know? In today's world, before somebody goes to a dentist, a chiropractor, a podiatrist, an audiologist, a muffler shop, what are they going to do? they're going to check you out,
Yes, they are.
right? And your representation and your reputation has got to be pretty good, as Larry David might say, right? It's got to be pretty good. So, number one, the best way to manage your online presence and online reputation is with a company like Entropy, which can help insulate you and protect you, right? And have basically a scrubber in place.
Yep.
So anybody that's in healthcare that's not using a scrubber, I don't know the real name for it. You guys know.
Yeah,
But
reputation management tool.
yeah, you're crazy. You're just crazy
Yeah.
because a lot of people are crazy
Are crazy.
and,
Yeah.
and letting people
For
just
sure.
post random stuff and hoping for the best is insanity. Don't do it. Call Entropy, get a reputation management system in place. If you don't, you're insane. Seriously.
And that's,
So
I
you
mean, it
shouldn't
really
even
is
be in
true.
business. You shouldn't even be in business.
Passive
So,
leads to negative.
right. So what you've got to do is think like Starbucks. Think like, you go to the mall could be empty. What store is standing room only? Apple.
Yeah.
The
Yes,
Apple store.
always.
Rest of the mall, empty,
Yeah.
empty stores, but the Apple store is packed. Starbucks, people in line
Yeah, always.
to pay $7 for a coffee. Tell your
Mhm.
grandfather you're paying $7 for a cup of coffee.
Oh, you'll get a
He's going to
lecture.
Baker Act you.
Yeah, for sure.
Right? Right. What about Chick-fil-A?
Oh,
I
killing it.
mean,
Oh,
morning,
people
noon,
spend
and
more
night.
time in Chick-fil-A's line than anyone else. But what can you do? You're like
Insane.
3 lines
So let
wide.
me give you an example. Do you know that the average revenue per year for a KFC store is $1 million? The average revenue for a Chick-fil-A store, $4 million.
And they're
It's not even
closed.
that.
And they're closed on Sundays.
And honestly, I think Wendy's has a better chicken sandwich. So
Oh,
it's or Popeyes. So it's not even about necessarily the product. Perception is reality.
For sure.
It's the power of your brand.
Oh yeah.
It's the
For sure.
power of your brand and the experience. How hard is it? Please, thank you. Did you have a good visit today?
Mhm.
So all of that. Now at AIB, we have, I think here locally, we have maybe 10 doctors and I've got 4 or 5 residents, right? But guess what they are all trained to do? When that patient is in front of them, I'm here to serve you.
Mhm.
I'm here to help you. Before every patient leaves, these are the questions we ask. Do you feel that your evaluation today has been thorough? Do you have any questions for me before you leave? Do you understand the plan of care that we're recommending for you?
Mhm. Yeah.
And then guess what? They leave with a very big presentation folder with all the materials and their plan of care so that the patient understands we know how to make you better. We know how to get you healthy. We know how to get you back to work, back to school, back to playing soccer, whatever the case may be. So patient engagement starts, number one, with your scheduler.
Mhm.
You better shop yourself. You better have your friends or relatives call
Good.
your scheduler.
For sure.
Because if you have some wacko trying
Yeah.
to schedule patients who's not caring, informative, comforting, that's where the so the patient experience begins. Your online reputation
100%.
and your scheduler,
Mhm.
Yes.
right? I'll tell you something. I dismissed an employee that had been with me 12 years because over time, guess what? She took her oars out of the water and was starting to do weird stuff. We coached her once, we coached her twice, We coached her 3 times. I'm sorry. You got to go.
Mm-hmm.
Yeah.
You're hurting us.
Yeah, it's great
Right.
advice for anyone out there. What Richard's talking about too is kind of that first initial patient experience.
Yeah,
One is online,
huge.
2 now they're calling in and taking action. And it's always interesting with a lot of our clients. We do tell them exactly what Richard just said. Give your own practice a call. Have somebody call your practice for you. Try to evaluate kind of that initial contact. Are they on hold? Is the call being answered? Are they being addressed? Are
Mm-hmm.
questions being delivered? Is it pleasant experience? Whatever it is, just make sure you're kind of always monitoring that, because that can really influence just one call and then they hang up the phone and call your competitor. So
For
it's
sure.
a big deal.
And I would tell you also shop your competitors.
Yes, definitely.
Because shop your competitors, hear what they're doing right
Mm-hmm.
and hear what they're doing wrong, and then leverage both of those to your advantage.
For sure.
The other thing is, who's at your reception desk? Is it Attila the Hun? Sit down, we'll be with you in a minute.
Yeah.
I mean, what was the cost of patient acquisition? What was your cost of patient? There was some cost of patient acquisition, whatever it is.
Mm-hmm.
If you've got Attila the Hun at your front desk, Houston, we have a problem.
Mm-hmm. For sure.
Right? Oh, are you Ms. Jones? Hi. We're so glad you're here today. We've got everything online. You filled out your paperwork online. We're so glad. We're going to be with you very, very shortly. The doctor will come and get you. Shouldn't be more than 5 minutes. Okay? Great. So nice to see you. We reopened, we were closed April and May 2020. We reopened June 2020. So we've been living as a medical provider in the world of COVID since then. Was it like 18 months or whatever? And I will see sometimes online listservs of things. Oh, and people won't wear their masks, and people are this, and people are crazy. I mean, I'm not going to say we don't have that, but 99.99%, and we're in Florida, where things are
Where crazy is.
In today's
crazy.
news, yeah.
And we're in Florida, so we're not in a place where there is good governance about the pandemic. But we don't see that. People get it. And they're told on the phone that, you know what? We're not going to be able to see you. I'm not wearing a mask. You're taking away my freedom. You know what? The only other 2 facilities that do what we do, one is in Jacksonville, Mayo Clinic, or you can go down to University of Miami in Miami. We're the only 3 facilities in the state that provides these services. I suggest you call them. But just to let you know, they're probably going to make you wear a mask.
For
and
sure.
parking
Absolutely.
is a nightmare.
Yeah.
So we would love to see you, but as a healthcare provider, we have to protect our community and our patients. Our doctors are 100% vaccinated. But even though they're 100% vaccinated and you're vaccinated, guess what? All of the clinical staff will be masked during our visit together.
Right.
That's to protect you and us. And when rarely do we have people that are a problem.
So I'd be curious, switching gears just a little bit and going back. I know we talked about a little bit on the CSC side and using LinkedIn as a growth tool, which also goes back to the brand that y'all have built has made the process in terms of getting in front of people and telling your story a breeze. But what have you found? Because I think there's a lot of, I think it's interesting in terms of physicians are on LinkedIn a lot more than people think. I think they're more active and engaged, and that is ever increasing. What has been your surprise now using LinkedIn as a tool? And you're well known, you get good engagement already. Is the conversations that you're having, the doors that are being opened? What has been a surprise to you during this last 6 months or so on the CSC side as it's grown?
Well, a few things. First of all, we'd been on LinkedIn for quite a while,
Oh yeah, for a long
uh,
time. Yeah,
but
very
but
active.
but just talking about the science, about
Hmm. Yep.
research, patient care, and it really not uncommon for us to have maybe as high as 2,300 views
Hmm.
on LinkedIn. So I think we had somewhat of an already advantage that we, to a lot of people, we were kind of a known entity
Yep.
in
Mhm.
the educational clinical research range. But I will tell you, because I actually see, even though we were using a system, I'll let you and Kelly, if you want to explain it. But the way you've developed the messaging for us, people are, when they reply, even if they're not interested, it is in such a courteous, pleasant, it's they really feel like I'm speaking to them personally and I'm reaching out to them.
Mhm.
So I will tell you that at least three quarters of the not interested, no thanks, also has a comment. Oh, thanks, Dr. Gans. I've been following your work for years. Oh, I went to one of your classes 5 years ago. So um, it's funny because, as a business owner, I am solicited multiple times a day
Yeah.
by people on LinkedIn.
Oh yeah, absolutely.
Clueless,
Yep.
clueless. It's just random, no thought to it,
Yep.
nothing. Just, it's truly spam.
Mhm.
Hmm.
Just
Oh yeah,
blah,
and it's
right?
Unfortunately,
getting
yeah.
worse every day for sure.
Right. We're not seeing that at all because of the nature of the conversation, because of the targeting. So, my surprise is the collegiality and the
Hmm.
courtesy and the kindness of the thanks but not interested folks.
Hmm. Yep. And
Because
I think it goes back.
we have not, seriously, I don't know how many hundreds of responses we've had. You guys would know that. But I've not had one say, leave me alone, take me off your list. This is crap. This is awful. Not one.
Yeah,
Everybody
that's amazing.
is thank you, very
Hmm.
kind, maybe in a year. It just really like we're having a
Yeah.
real personal dialogue. And that to me has been great because there's an old saying, if you don't make a sale, make a friend.
Absolutely. I could not agree more. And that's, but I think again, it speaks a lot too, because even what you're saying, even people that are thanks but no thanks, I have been seeing you out there for a long time, and I think it's a
Yeah,
testament
it's
on when you do, because it's not even. I think it's less sales and it's more about conversation starters, like you
yeah.
said, and that's what I think the value of LinkedIn that people miss is. It really is networking at the end of the day, adding value. Contributing to kind of your space and your niche, and you've been doing that for so long that it's made the things like what we're doing in terms of the outreach so much more effective because they see real authenticity behind you, the story that's being told, all of that stuff, and
Well,
that's
and you
huge.
shared, like you said, you have open communication, open
Yeah.
resources, and I
Yeah,
think that's really come a long
yeah,
way. And that's a lot what we
And
tell some of our
oh yeah.
healthcare clients in building your
Yep.
brand and building authority. A
yeah.
lot of it comes with being very open about certain topics that provide so much
Right.
value that people start to associate you as an expert in
Hmm.
the
Yeah,
field. And I think at AIB and dizzy.com, I mean,
yeah,
like you said, you've been on LinkedIn a while, but you've also been in person. You guys
Yeah, for
really
sure.
hustle to
yeah,
get out there to connect with these providers, to educate,
yeah.
and you don't make it such a deal breaker as far as if
No,
they interact and connect that you just, you know,
in
don't.
doing this, really, I was kind of like the Johnny Appleseed of dizziness. Um, you know, 40 years ago, when I left the Ohio State with all of this great knowledge, and we started our private practice in 83, doing neurodiagnostics and talking about helping the dizzy patient and the balance patient. We were so far ahead that people thought I was a kook. People just thought, well, we don't understand this. We don't,
Yeah.
what are you talking about? And it took, I mean, I used to go, if I was invited to Oshkosh, Wisconsin, they'd give me a coach, plane ticket, and $200 to give a talk, right?
Mm-hmm.
So I'd have to fly into Milwaukee, drive 2 hours to Oshkosh or whatever, and talk to 12 people in the basement of a hospital,
Yeah.
right? But I did that, and I did that for years. But so, for example, we have done just in the last 20, 22 years, I have given 150 invited international talks in 35 countries.
Wow.
I've been to India, the UK, I've been to China, Hong Kong, Colombia, Argentina, Brazil, 35 countries. So,
That's amazing.
you know, because people are hungry for knowledge and information.
Mhm.
And if you perceive yourself as a healer in the medical field and open your arms to people and are willing to say, here's some contributions, here's some things you can do to help your patients, and don't necessarily worry about monetizing that, because if you try to monetize every single thing you do, you're gonna get the reputation of being a little bit of a slick Willie.
Mm-hmm.
You've got to be,
Over time.
you've got to kind of be willing to give. You know, um, not to be biblical here. It's not Sunday morning, but right, you're going to reap what you sow.
Yeah.
So you've got to make that investment. It's not just an investment of money, right? It's an investment of doing the right thing. So what we like to talk about in the medical field is, let's do well by doing good. Let's do well by doing good, right? If we take good care of patients, if we are perceived by patients and our colleagues as healers and not just business people,
Mm-hmm.
that's how you build that reputation. So, for example, we've seen children for free for 30 years. No child has ever been turned away from my facility.
That's excellent.
So if we have parents
Fantastic.
that don't have insurance or don't have access, whatever, unrestricted, we see the child for free. We have a foundation. We'll say to the parent, look, we do have a foundation. You can go online. If you have an extra $5 or $10 and would like to make a contribution, great. If not, don't worry about it. But no child. So do you know what that does to our reputation in this community? To say that we open, every child will be seen.
Yeah.
With special needs, with whatever. No child under 18 is ever turned away. Ever.
Amazing.
What? So but what is the cost of that? And the my facility won't do that. They're stupid. Because what do you think how many millions would I have had to spend in marketing to get that kind of a reputation?
Mm-hmm.
Yeah. And this is authentic.
Parents tell other parents, physicians tell other physicians. And guess what? That child whose parents don't have insurance, the grandmother or grandfather's on Medicare.
Mm-hmm.
The uncle or aunt has insurance. The next door neighbor, right?
Yeah.
The physician's other patients
Yep.
are in an HMO or a PPO.
Yeah. It always comes back around.
Or friends.
Yeah.
Well, thank you so much for joining us today. Again, for all of you tuning in, this is Richard Gans. I highly, highly recommend that you start following their content and connect with him. He's a real genius when it comes to healthcare, business, marketing, but most importantly, patients first, and helping providers across the country and the world learn how to effectively grow grow their practice and treat patients without the hassle and get to focus on what they love. They're a partner of us here at Entropy Healthcare Marketing and Physician Liaison University as we train all their physician liaisons across the country. So we are just so happy to have you, Richard. And I wanted to make sure that everybody knows they can find you dizzy.com, they can find you at AIB, but how would you like everyone to connect with you?
Well, the easiest thing, just info@dizzy.com.
Perfect.
Info@dizzy.com.
Excellent.
And I want to again thank Justin and Kelly. You know, I had been following Kelly on LinkedIn, and I was so impressed with her messaging.
Thank you.
And I said,
you
know what? Our 86 clinics around the country need her.
Oh,
And
that's so great.
then
Thank you so much.
we met Justin and his great team, and we said, we need them. So they are our dynamic duo. Entropy and Physician Liaison University are very, very special strategic partners, both for AIB's own marketing and the needs of our 86 centers of specialty care. We hope soon to be 100 by year's end.
Yes, absolutely. Well, thank you so much, Richard, for being such an amazing partner and
what you're doing.
All the tremendous work that y'all
there.
are doing. It's so much fun to be able to collaborate together. And just like we were talking about before, it really is the tip of the iceberg. And so you'll definitely be seeing a lot more collaboration in terms of content and all these other things that we've got, not only to finish this year out, but going into 2022. And don't forget too, before we wrap, not only will we have all of Richard's contact information as well as AIB's in the show notes, but this is also going to be turned into a podcast. So if you weren't able to tune into the live, it will be turned into a post on LinkedIn. So you'll be able to see it there. But this is also, if you listen to the Patient Convert podcast, which if you don't, go subscribe on your favorite listening channel and leave us a review. But this will also be coming in the next few weeks as one of our new released episodes. So you can hear it repurposed over there as well.
And Richard, can you share your organization, your foundation as well for anyone interested in donating or supporting the cause?
Yes. If you go online to dizzy.com, just scroll down, you'll see our foundation. We're always happy. It's a 501c3. So it is tax deductible. Let me also mention AIB clinics takes no money. There are no salaries. There are no rents. 100% contributions go to education and research. So AIB takes zero. We have no paid board of directors. AIB donates space, rent, staff. We do not reimburse ourselves for seeing the children in the clinic. 100% goes to research and education of those serving the pediatric and adult population.
That's fantastic. Well, definitely make sure you go check it out. And thank you, Richard, again for taking some time out to share your story and what y'all are doing over at AIB, and look forward to everything that we have ahead.
And thank you everyone for joining.
Yes, thank you for joining.
Thank you both.
These questions, answers, connect with Richard. Look out for the podcast on Apple, the Patient Convert podcast, where we'll dive in a little bit more. And we will definitely be doing more of these with Richard as he will share a little bit more about the journey and some of his wisdom on how you as a provider can really create the process that works for you, as well as making happy staff and patients. So thank you guys so much.
Thank you, everybody. Have a great weekend.
A great weekend.
Bye.
Take care.